I am Dr. JAYVANT VASANT KHARAT, Assistant Professor in Shalakya Tantra Department of Honorable Shri Anna Sahib Dange Ayurvedic Medical College, Ashta. Today, I am going to teach you external ear and its diseases. It is important topic for practically and theoretically also, because so many patients are come with external ear problems. Means some of them come with earwax, some of them come with foreign body, some of them come with furuncle, ear furuncle, or other diseases. So, or perforations, especially tympanic membrane perforation, traumatic or diseased. So, this is important topic for practical and theoretical also. So, we are moving forward. Points to be taken in mind. What are the points to be studied in this lecture or in this topic? Anatomy of external ear, physiology of hearing or pathway of hearing, hearing pathway, because some conductive pathologies are seen in external auditory canal or tympanic membrane or auricle or pinna. So we must know before the diseases there is physiology of hearing or hearing pathway. We must know hearing pathway, and then we will go to the diseases. Diseases first auricle or pinna diseases, then second external auditory canal diseases, and third one tympanic membrane diseases. Okay. External ear. I am not going to take anatomy in detail. Some of the points which is important for applied anatomy, or it is to be important for surgical process, treatment process. Anatomically, external ear consists of three parts or structures. Auricle or pinna, you can see in this picture. I am showing you by the cursor or arrow. Auricle or pinna, then external acoustic canal or external auditory canal, then tympanic membrane. These three structures consist as a whole external ear. Okay, then we will move forward to the separate anatomy of these structures. First, auricle or pinna. You can see in this picture helix, antihelix. All these are helix, antihelix, tragus, antitragus, lobule. These are the parts of auricle or pinna. Okay. External auditory canal. Skin-lined apparatus, length 24 mm, in which cartilaginous outer 1/3 part is 8 mm and bony inner 2/3 part is 16 mm. Canal is S-shaped. While we are performing the otoscopy or any tympanic membrane examination or EAC examination, we have to straight the S-shaped canal. So how it will make as straight? It is directed upwards, backwards, and medially, while inner part is directed downwards, forwards, and medially. For examining the tympanic membrane, pinna has to be pulled upward backwards and laterally, so that the canal becomes straight. Okay. Third one is tympanic membrane. Tympanic membrane, pars flaccida. There are two parts. One pars flaccida, and here big part is pars tensa. Small part pars flaccida, upper part. Whole part pars tensa. Handle of malleus, umbo region, cone of light. There are four quadrants. Which are they? Anterior superior, anterior inferior, posterior superior, posterior inferior. You can see in this picture also pars flaccida, pars tensa, cone of light present in the anterior inferior quadrant. Okay. Tympanic membrane is thin translucent membrane connection between external ear and middle ear. Vibrates in response to sound waves. Color pearly white. Position obliquely situated. Parts 2, pars tensa and pars flaccida. We can say it as shrapnel's membrane. Layers 3, outer epithelial layer, middle fibrous layer, and inner mucosal layer. There are four quadrants: anterior superior, anterior inferior, posterior superior, posterior inferior. And cone of light is present in the anterior inferior quadrant. Then what is the physiology of hearing? Normal hearing pathway. Sound waves are collected by pinna. Afterwards travels through EAC, external auditory canal, strikes on the tympanic membrane. Then the vibrations created on the tympanic membrane are transmitted through the oval window by ossicular chain. The vibrations of stapes fruit plate causes pressure changes in the labyrinthine fluid, which causes movement of the basilar membrane. Thus, organ of corti is stimulated, which converts the mechanical energy into electrical impulses or electrical energy, which are then carried by auditory nerve to the hearing centers in the temporal lobe. Okay. When sound waves from the environment are collected by pinna, here why this is important to know the physiology of hearing, because some of sound waves are collected minimal by auricle or pinna congenital anomalies. What are these anomalies? Which are these anomalies? We can see it later. But it is important to know the structures. There are three structures in external ear. External ear, auricle or pinna, external auditory canal, and tympanic membrane. These three structures are important for the conduction of sound waves from the environment to the internal ear or auditory cortex. So there is a problem or there is a pathology regarding congenital, traumatic, or inflammatory. Then there is a conductive deafness or hearing loss, or traumatic hearing loss is there, or sensory neural hearing loss is there. That's why we have to know the physiology of hearing normal or normal hearing pathway, and then we have to know or we move forward towards the diseases. Okay. You can see in this picture from the external environment, sound waves collected by pinna travels through EAC, strikes on the tympanic membrane, and then it will move towards the auditory cortex, temporal lobe. Sound energy, first mechanical energy, then converts into electrical energy. Okay. Diseases or of auricle or pinna. We divided we can divide the diseases of auricle or external auditory meatus or tympanic membrane into the three categories. First, congenital, second, traumatic, and third, inflammatory. Congenital, bad ear, abnormally protruding ear, concha is large with poorly developed antihelix and scapha. Surgically corrected after 6 years. Preauricle appendages, skin is covered tags that appears on a line drawn from the tragus to the angle of mouth. Okay, I will show you pictorial congenital anomalies of the auricle or pinna in next slide. Preauricular sinuses seen at the root of helix due to the incomplete fusion of tubercles. Anotia means complete absence of pinna. Macrotia means excessively large pinna, and microtia means pinna is abnormally smaller in size. Okay, you can see in this picture all congenital anomalies. Bat ear, then these are preauricular appendages, preauricular sinuses, then anotia means complete absence of pinna, macrotia means large size pinna, microtia means small size of pinna. Okay, then trauma, hematoma of the auricle, laceration or avulsion of pinna, frostbite, keloid of the auricle. Hematoma, collection of blood between the auricle cartilage and its perichondrium. Extravasated blood may clot and then organize, resulting in the typically deformity called cauliflower. Here there is hematoma, but occupational cauliflower ear deformity is seen pathologically. Treatment, aspiration of the hematoma and carefully packing all concavities. Then laceration should be repaired as early as possible. Traumatic lacerations are there. Perichondrium is stitched with absorbable suture. Avulsion pinna, pinna is still attached to the head by pedicle of skin. Normally primary detachment is considered. Completely avulged pinna should be implanted by microvascular techniques. Frostbite, injury due to the frostbite, erythema and edema, bullae formation, necrosis of the skin. Treatment, rewarming with moist cotton pledges at temperature 38 to 42 degrees Celsius. These diseases are not commonly found. Which are the diseases commonly found? We will see in the detail in later. Keloid follows trauma or piercing of ear for ornaments. You can see in this picture, due to ornament or due to piercing of the pinna, lobule, auricle, keloid will form. Keloid will lead. Usually sites lobule and helix. Treatment, surgical removal. Okay. Inflammatory conditions, perichondritis. Perichondritis, inflammation of perichondrium or auricle or pinna with pus between perichondrium and cartilage. Okay. Pseudomonas, Staphylococcus aureus infection and secondary infection form other ear pathologies. Burning sensation of ear, painful movement of the ear because skin and cartilage are strictly adherent. Then fever because infective conditions is there. Body ache, pinna totally deformed like cauliflower. Okay. Treatment, Antibiotics based on clinical symptoms, local 4% aluminum acetate application, incision and drainage tube with multiple openings and pressure bandage. Okay. Then diseases of external auditory canal, congenital, trauma, inflammation, tumors, and miscellaneous. We will see in the detail. Congenital and traumatic. Congenitally, atresia of ear canal or color fistula. Color or traumatic, laceration, minor and major. You can see in this picture atresia of the external canal may or may not occur in association with microtia. You can see in this picture atresia of the external canal. Then coloral fistula, abnormality of the first branchial cleft. Fistula has two openings. You can see in this picture. Situated in the neck, just below and behind the angle of mandible, here and here, in the external canal or middle ear. Trauma, minor laceration, Q-tip injuries, unskilled instrumentation by the physician, major gunshot wounds and intense injuries. Injury to the mandible is involved. You can see in this picture, there is a laceration and there is suturing of laceration. Inflammation, this is important, and these pathological conditions or inflammatory conditions like bacterial, fungal, viral, miscellaneous are the important diseases in the external ear. So bacterial, localized otitis externa or furuncle, diffuse otitis externa, fungal otomycosis, viral herpes zoster oticus, miscellaneous impacted wax, foreign body. Okay, we will go in detail. Furunculosis or furuncle or localized otitis externa, inflammation of hair follicles, Staphylococcus aureus, Pseudomonas aureus, and Proteus may spread subcutaneously, cause cellulitis. Scratching ear canal, allergy, immunocompromised patients, diabetes, depression. In these conditions, furunculosis may happen. Symptoms: pain, earache, mild hearing loss due to occlusion of lumen of the external auditory canal. Sometimes discharge present, it is purulent. Sign, cardinal sign of the furunculosis is pinna tenderness or pressuring tragus. Pinna or pain after pressuring tragus. Furuncle seen in EAC. Sign, pinna tenderness and furuncle seen in EAC. What is the treatment for furunculosis? Patient come with you for severe pain, with severe pain because he can't bear or can't tolerate the pain of furunculosis, because there is furuncle in cartilaginous part of ear, external ear, and cartilaginous area is strictly adherent by skin, covered by skin. So if there is hair fall infection or scratching or any injury to the cartilaginous part, then pain will radiate throughout the cartilaginous area. So pinna tenderness is there. Oral toilet means cleaning of the external auditory canal with the help of probe and cotton. Local treatment, maxilglycerin medicated wick is inserted for 8 to 10 hours. Then with the help of maxilglycerin wick, you reduce the swelling and pain of the furuncle. Systemic antibiotics, analgesic antipyretics you can give. Ayurvedic, Yashtimudhu Siddhaghrut for the Karnapuran or for the medicated weak. You can see the picture of furuncle. Okay. Diffuse otitis externa. We have seen the localized or generalized localized otitis externa or furuncle. Then we will go to the diffuse or generalized otitis externa. Diffused inflammation of the meatal skin, which may spread to involve pinna and epidermal layer of the tympanic membrane. Okay, commonly seen in swimmers. Two main factors responsible: trauma and inflammation. Common organisms are Streptococcus aureus, Beta proteus, and Escherichia coli. Clinical features: acute phase and chronic phase as there. Hot burning sensation in the ear, followed by pain, which is aggravated by movements of jaw. Okay. Then chronic phase, irritation, itching, and strong desire to itch. Treatment in acute phase, ear toilet or medicated wicks or antibiotics and analgesics are used. In chronic phase, reduction of meatal swelling by ear toilet and using a gauze wick soaked in 10% ethanol or MgSO4 with glycerin. Okay, diffuse otitis externa. Somehow same treatment for localized and generalized otitis externa. Then important disease of the external ear, that is otomycosis. We can say it as Karnakandu. Fungal infection affecting external ear mostly in rainy season. The rainy season is coming or came already. So in these days, you can see the patient of Karnakandu or otomycosis. Some diabetes and immunocompromised factors predisposes. Means in diabetes there are Kapha-Medaj or Kapha-Cledaj pathologies. So clade in the external ear or Cledagen pathologies of external ear, we can say it as otomycosis or debris collection. You can see in this picture. Okay. Aspergillus niger, black-headed, others candid, albicans, white. These fungus or debris may seen it in various colors. Like if there is a pathology or there is a fungal pathology of candid albicans, then you can see it as white. Then aspergillus fumigatus, then you can see it as in green or brown color, and aspergillus niger you can see it in black color. Okay, otomycosis symptom. Cardinal symptom of otomycosis: intense itching followed by pain. There is itching, but intense itching, and always intense itching followed by pain. Patients are very much aggressive for the itching with the unskilled instrumentation which is available at that time. Discomfort, hearing loss may discharge sometime, watery discharge with musty odor, fungal mass might be seen. Means in otomycosis you can see the otoscopic picture as fungus or debris seen in EAC. Signs: fungus or debris seen in EAC, black aspergillus niger white Candida albicans, and blue or green in Aspergillus fumigatus. You can see the picture of color of the different fungal pathologies. Then otomycosis treatment, oral toileting or cleaning with the help of syringing or suction. Recurrent follow-up of the oral toileting or cleaning or suction or syringing is important in the otomycosis to avoid the recurrence, because recurrence is the most common in otomycosis. So regular follow-up of the patient is most important in the otomycosis. Then antifungal tablets you can use like fluconazole, cotrimazole, antifungal drops, nystatin, fluconazole, clotrimazole are used for the 2 times. Keep ear dry. Treatment of underlying diseases like diabetes, and Ayurvedic Trifala Dhavan and Karna Prakshalan. Trifala or any anti-infective Ayurvedic medicines you can use. Herpes zoster, formation of vesicles on the tympanic membrane, meatal skin, concha and post-auricular groove. You can see in this picture. Neurodermatitis due to compulsive scratching due to psychological factors. Main complaints is intensive itching. Dermatitis, so itching is present. Treatment is sympathetic psychotherapy and secondary infection, if any, you can use. If dermatitis is there, then you can use it, antidermal creams and all. Eczematous otitis externa results from the hypersensitivity to the infectious organism or the topical eardrops like the chloromycetin and neomycetin. Symptoms: intense irritation, vesicle formation, crust formation, and oozy. Treatment includes withdrawal of the steroid and some antifungal or anti-eczematous treatment is there. Seborrheic or seborrheic otitis externa associated with seborrheic dermatitis of the scalp. You can say it as dandruff-like conditions. Itching is the main complaint with grayish yellowish scales skin in the external ear. Anti-dandruff shampoo, etc. used. Ear toileting, ointment with salicylic acid and sulfur you can use. Then miscellaneous diseases, there are few are importance in which wax or cerumen and foreign bodies. These two are very much important in the miscellaneous conditions. So wax or cerumen, mixture of ceruminous or sebaceous gland with discomated epithelium in EAC. What are the functions of cerumen? Antibacterial action, traps dust and moist foreign body. Causes of excess wax collection. What are the causes? Which are the causes? Excess formation of the cerumen, less oily, narrow canal, hot and dry climate, stiff hair in ASC. What are the symptoms, signs and treatment of the impacted wax? Symptoms: hearing loss because conductive deafness is there. Sound waves collected by pinna is not traveled due to the obstruction of wax. Irritation and itching. Then otalgia or earache due to excessive swelling or of impacted wax. Due to excessive swelling, wax will impact on the nerve endings which are present in the external auditory canal. Then it will lead into pain. So in the impacted wax or debris or furuncle or foreign body, in the Ayurveda, Acharya said that Samanya Chikitsa, that is Samanyam Karnarogeshu, Grutapanam Rasayanam, Avayamo, Ashirasnanam, Brahmacharyam Kattanam. Ashirasnanam. Because when there is water enter into the EAC with impacted wax, then wax gets swelled and it impacted or it pressurized on the nerve endings of the external auditory canal. Hence, earache is oftenly seen. Tinnitus sometimes seen, cuff reflex due to vasovagal stimulation or an Arnold's nerve, cuff reflex and vertigo is seen. Okay. Signs: vaccine in EAC may be impacted or partially impacted. What is the treatment? Firstly, assure the patient about cuff reflex and vertigo due to vasovagal stimulation, due to probing or any instrumentation in the external auditory canal. Then what are the methods? There are three methods are using or used for the removal of wax. What are these three methods? One, by probe, second by syringing, and third by suction. Okay. By probe, if wax is hard, then you can use the waxolytic agents, Kshar tel in Ayurveda or Bilwadi tel in Ayurveda for Karnapuran. Then after 3 days, after softening the wax, you can remove it by probe. Then if there is a condition of impacted wax, so first you have to make pocket for the syringing, and after the pocket formation, you can use this syringing method for the removal of wax. Lumen is totally obstructed by impacted wax. If you make pocket on the posterior side or superior side, then the normal saline is easily passed through that pocket, and after that wax get removed by the syringing method. By suction, if the wax or debris, any conditions like the impacted wax present behind the isthmus or debris present behind the isthmus, you can easily remove by suction method. Okay. Sometimes analgesic and antifungals are used after the total removal of wax, but analgesics are used for the earache produced due to the impacted wax. Foreign bodies in ear, there are two types of foreign body, living on and non-living. Non-living, grain seeds, pebbles and sand particles. Living, insects, mosquitoes, ant, like these living organisms are present in the ESC. Symptoms: earfulness, earache, sometimes hearing loss and loss of confidence. Some is present in the ESC is leads or will leads into loss of confidence because mentally or there is psychological condition in the foreign body. Some foreign body like insect or grain seeds is present in external canal. Then patient gets psychologically depressed and loss of confidence is there. Signs foreign body seen in ESC, if longer duration is there, then granulations or bleeding is seen sometimes. Treatment of foreign body removal, if there is living foreign body, then first aid in the living foreign body is suffocation with the help of water. Some peoples are using oil for the suffocation. Generally, all the peoples are using oil, but water is likely to be more safe because you if you use oils, then fungus or fungal pathologies will seen afterwards. What are the methods are using for the foreign body removal? First, forceps. With the help of forceps, you can remove the foreign body. Syringing, with the help of syringing, like sand particles or any ant or any mosquito is there, then you will go for the syringing. You will prefer the syringing. Suction, if the foreign body present behind the isthmus, then you go to the suction. You will prefer the suction. Microscopic removal, as I said earlier, the foreign body which is not easily catch or grab by the forceps, then you will prefer the microscopic removal. If there is no condition for forceps or microscopic removal, then you will prefer the post-oral approach. Or any foreign body with granulations, bleeding, and completely obstruction of the lumen, then you will prefer the post-oral approach. Antibiotics you can give for the prevention of infection, analgesic for prevention of pain, and antifungal drug if needed. Then third structure, that is tympanic membrane. We will move towards the diseases of tympanic membrane. What are the diseases of tympanic membrane? Retracted tympanic membrane. When there is a pathology in the middle ear or in the pathology of eustachian tube, then middle ear pressure, which is positive in normal condition, it will turns into negative pressure, and then tympanic membrane is normally mobile or obliquely situated. It will turns into retracted tympanic membrane due to negative pressure in the middle ear cavity due to obstruction in the eustachian tube. This condition is seen in acute otitis media or catarrhal stage of acute suppurative otitis media. Why? Because pathology is moving towards the middle ear cavity from the nose. Then eustachian tube is normally patent, but due to the inflammation, it will get obstructed. Hence, the middle ear pressure, which is positive, turns into negative, and tympanic membrane gets retracted. Okay? Are you getting me? Then second one, myringitis bullosa. It is viral infection. Hemorrhagic blebs are present on the tympanic membrane. Herpes zoster oticus. It is also viral infection in these vesicles on the tympanic membrane. Myringitis granulosa associated with impacted wax or foreign body. Atrophic tympanic membrane in serous otitis media. Middle fibrous layer of the TM gets absorbed. Okay, there are three layers: outer epithelial, middle fibrous, and inner mucous layer of tympanic membrane. In the serous otitis media, middle fibrous layer gets absorbed. So atrophic tympanic membrane is happened. Tympanosclerosis, that is hyalinization and calcification of tympanic membrane. Chalky white plaques are seen in or on in tympanic membrane. Tympanic perforations, retracted tympanic membrane and tympanic membrane perforations are the important diseases of tympanic membrane. What are the conditions in which tympanic membrane perforation will occur? We have to know these conditions, because what are the types of perforation, what are the conditions of perforation, we must know. Then tympanic membrane perforation, two types: one pathological or diseased perforation, and second one traumatic perforation. Tympanic membrane perforation, pathological or diseased perforation, in which you can see central and marginal perforation. In the central perforation, again it will divides into two types: central perforation divides into total perforation and subtotal perforation. Total perforation means central perforation which is in small size and most of the circle is covered by tympanic membrane. In subtotal perforation, big size of hole is there, perforation, and small size of tympanic membrane is left intact. So pathological or diseased perforation, in which attic means perforation in the attic region, means pars flaccida region of the tympanic membrane, which is dangerous or which is safe. Central perforation is safe, non-dangerous, but marginal and attic perforation is dangerous and unsafe. Okay. Then traumatic perforation, trauma due to hairpin, due to Dolby sounds, due to cracker sounds, due to slapping, all these conditions will lead into the traumatic perforation of the tympanic membrane. Okay. Diseased condition, in the diseased condition, acute suppurative otitis media, chronic suppurative otitis media, like this, pathological or diseased perforation is there. Then what are the difference between pathological and traumatic perforation. You can see in this slide, there are four important differences between pathological and traumatic perforation. What are these four? First, history. In the history of pathological perforation, definitely disease condition is there. But in traumatic condition, history of trauma, as I said earlier, hairpin, slapping, sounds with high intensity like Dolby or slapping, or any trauma which leads into traumatic perforation. Then margins. Perforated margins are regular in the pathological perforation and irregular in the traumatic perforation. Okay? Because due to trauma, tympanic membrane is irregularly perforated. So the margins are irregular. And pathological perforation is due to middle ear pathology. That's why the perforation is planned, and that's why the perforation margins are regular. Color of margins. When middle ear inflammation turns into middle ear infection, then yellowish pathology or separative pathologies are seen in middle ear cavity. When discharge comes to the ESC through tympanic membrane, through regular margins, then due to separative pathology, the margins are yellowish. Margins are yellowish. Pus color is yellowish, so margins are yellowish. But due to direct attack, direct trauma on the tympanic membrane, there is a rupture of capillaries present in the margin of tympanic membrane. So the color of margins in the traumatic perforation are reddish because of the capillary breakdown of the margins of traumatic perforation. Discharge. Pathological perforation means it present in the acute suppurative otitis media or chronic suppurative otitis media, then definitely discharge will present. And in the traumatic perforation, there is no middle ear pathology, so discharge is absent. Discharge will absent. Okay, these are four differences or difference between the pathological and traumatic perforation. Okay, I think you all are getting me. Are you understood about the external ear disease? Hope so. You are all are getting me the knowledge of external ear diseases. Thank you. Thank you very much for patient listening.